So, and just like we see with patients, not being satisfied and not, being, fulfilled is going to be different for each person.
Right.
Because we're all different and, our constitutions are different in the way we play out our lives. And there's a lot about our constitution that makes us really strong and great and all that. And then there's these other things that are sort of the negative side that we have to clean up and say, that's not a good use of my superpowers aren't being used over there very well.
Welcome to Are You Satisfied? A podcast that explores what a deeply satisfying and fulfilling life looks like and how to live it. I'm your host, Dr. Sarah Murphy, award-winning naturopathic doctor. Today's guest is a professional mentor and hero of mine. He's one of my favorite naturopathic doctors, Dr. Paul Anderson. He's a renowned clinician and educator with a focus on complex, chronic, infectious, and oncologic illness. He has 3 decades of experience with many accomplishments, things like heading government research on IV integrative therapies for cancer and co-authoring success breakthroughs with Jack Canfield. Today, we'll discuss the interplay of mindset, satisfaction, and health. Okay, well, welcome to the show, Paul. I'm so happy that you have agreed to come on the Are You Satisfied podcast. And I've invited You're welcome. And I've invited you here today because of your wealth of knowledge and experience in the health and wellness industry. And you have been a dedicated leader and teacher for naturopathic doctors and helped many patients throughout your professional career. So I thought that we could have a good conversation, interesting conversation about life satisfaction and fulfillment and how do we get it? What are the keys? What are the secrets? That sort of thing. So does that sound good?
Sounds good to me, yeah.
Okay, great. So before we get started, I'd love for you to share, I know that you started in the conventional medicine world and then eventually moved over to holistic and natural medicine. So tell us a little bit about that story and how that happened.
Yeah, so long time ago now, I was in the we could consider regular medical world in the laboratory world and a few other things in that area. And I had always intended to go back to school and finish standard MD medical school. And along the way, we have 5 adult children, and they're all in their, 30 plus-ish. So when the older ones were little, they started to kind of get the normal kid sickness, where they get a lot of earaches and all that. And we were kind of in this cycle of taking the older 2 into the pediatrician, like almost weekly with something. And we were kind of getting frustrated with that, obviously. And my mom actually told me that she knew this naturopathic doctor and just to call him. So I called him, and he was very generous with his time, and he gave me some ideas, and we wound up taking the kids in. And I was just really impressed with the way he dealt, with what was going on with the kids, and also the orientation being more getting them healthy and keeping them healthy, because that wasn't really the orientation before. And so over time, I started to see this guy as a patient, and I became really intrigued with the practice. And I don't know that I knew it, but I was sort of probably always interested in doing medicine from a broader point of view. And so then he was sort of my gateway into the other side. So at that point, I actually owned a lab at that point, and I sold it and went back to school and went to NCNM, the Naturopathic Medical School in Portland. And the rest is history.
Cool. And I know that in your career, you've worked particularly with patients, a lot of cancer patients, a lot of patients that have critical diagnoses or complex diagnoses, hard to treat illnesses, often coming to you as more of a last resort after they've seen lots of other doctors. Mm-hmm. So, for the purposes of this podcast, I think it's easier to talk about how do we find satisfaction and happiness in even just a normal, regular life. That can be a challenging question for people. Yeah. And then it becomes an even, I think, deeper and harder question when someone's faced with severe health diagnosis. So What have you seen and learned in working with all of the patients that you've worked with?
Yeah, I think both from the point of view of just, we have to take care of ourselves, and a lot of times we're not great at, developing good habits around being centered and happy and all of those things. But I guess to start from the patient side of things, as you said, my patient population for most of my career has been either cancer or kind of nasty chronic illnesses where a lot of the patients will describe it as it's like I have a terminal illness, but I'm not going to die from it. I just have all these symptoms and things that are, really unpleasant and bothering me. And so those two groups really have a lot in common. It's not an illness like, I broke my leg and it's very unpleasant, but I will heal up and then I'll be better again, or I'll do some rehab and be better. It's something that could potentially occupy, part of your life for the rest of your life. And I think that one of the things, although it's, of course, the healthy population doesn't always do this well, and the sick population, certainly 100% of them don't do this well, but one of the things I've seen with either cancer or chronic illness is that the presence of that in your life kind of can cause you to realign your priorities. And you can have this kind of harsh realization that this might not go away. I might have this with me for the rest of my life. Or I might, say in the case of some cancers, it might go into remission and I might do things to get, real healthy, but you're always a cancer survivor and there's more chance you would, have some cancer again. So in a sense, the kind of coming face to face with that realization, I have seen that be a catalyst for people to step back and say, okay, I don't like this idea, but that's the reality. And whatever I do about my physical medical health is one thing. But if I am constantly the victim of my disease, I will never be happy. And they go through kind of the hard work to figure out, well, why would I be happy? What would make me happy? What things can I focus on other than this illness I have? And I would say, while that's not certainly everybody who does that, there is a fair number of people when they're coming to grips with cancer or chronic illness where it's the catalyst to go and do that work. And one of the things I've seen is if at some point you don't, now the first week or the first month you have a diagnosis, you're just you're in denial and disbelief and all that. But eventually, if you don't come to something like that, I see not going down the road of looking for what makes me centered and happy and empowered and all those good things. If I don't go there, it affects your physical health because it's very disempowering to fall back into being a victim. It's very detrimental to a lot of physical factors, to be that way. So I think that it, unfortunately, a chronic or life-threatening illness can push you to find that more quickly, because I think those people who don't have those diagnoses, you feel like, well, I got quite a while to live, and you can divert your attentions, so to speak, so that you feel like you're happy and you feel like you're doing the right thing, but maybe you really aren't, at your core. So that's sort of that's a scene setter, but that's kind of the way I see it.
Yeah, that's interesting. It's pushes you out of denial and forces you to face what's going to make you happy and is your life worthwhile and fulfilling and what you want it to be. So almost a blessing. Illness can be a blessing in that way. Can I say that?
You can certainly say it. Some people feel that that's true, and some people would argue with you. But yeah, I think it can be, certainly, like any other thing in our lives.
And so, and like you said, the choosing to take on this question of happiness and find happiness in their lives can then, in a circle, affect their physical health. So what is there a difference between the patients that do better in their healing process and maybe even survive cancer or have less symptoms and the patients that don't do as well? Is there a difference in the mindset that you see between those two populations?
Yes, I would say definitely so, and I think both from my personal experience, just sort of looking backwards over a few decades of treating these patients and looking at, well, who, let's take out of it, this person was sicker and maybe didn't live as long or whatever. Just overall, who are the patients who really seem to kind of rise above this physical trouble and not only deal with that, but also, kind of find this internal, presence and center and empowerment, and did they do better overall? And certainly quality of life they did, but also I believe in the case of people who maybe had a terminal illness, even quantity of life was better, what they had. And when I was doing research to write the last book that I wrote, which is about a lot of this with cancer, I actually found that there's a fair amount of research on patient empowerment and medical outcomes. So things like the efficacy of pain management is definitely affected by your empowerment, as a human. Quality of life measures are affected, and other, what we would consider physical things are affected, that you would think, well, that's just sort of a, medicine goes in and it affects the patient. Well, turns out the patient it goes into makes a big difference. And so, and I wasn't, I mean, I had sort of known this was out there, but I was specifically looking into it from the point of view of empowerment research for patient outcomes. And I was surprised how much there is out there that shows a clear link.
Mm-hmm.
And I think, a lot of people, especially when you don't feel well, I mean, let alone, it's depressing or anxiety producing or anger producing to know you have cancer when you get diagnosed, or someone says you're going to be probably dealing with this illness the rest of your life. There's a lot of emotions that go with that. So, it's hard to sit back and say, well, okay, yeah, I'll rise above that. But at some point, if you don't do that, what happens usually is the physical world is so, unpleasant to deal with, and maybe you're doing a lot of treatment and there are a lot of side effects or whatever. You can fall into being the opposite of empowered, which is being a victim. And those people definitely do not fare better quality and quantity of life wise. And I think it's easy, it's human nature to do that when you don't feel well, because when we don't feel well, it's sort of like, oh, poor me, and I get that. But at some point you have to sort of say, well, now I got to live the rest of my life. How am I going to do that?
Right. So it sounds like it's a process, easier said than done.
Yeah. Yes.
But that it is possible. And
Yeah.
patients do get to a point where they can rise above it.
Yeah, it's definitely a process. And just like anybody who's not chronically ill or who doesn't have cancer, if you really sit down, just personally take an inventory and say, am I satisfied with what's going on? Do I enjoy what I'm doing? Am I sort of fed by, my work and my home life and all this stuff? A lot of people would say, gee, I mean, especially in the last couple of years with all the extra stuff going on around COVID, a lot of people have, a lot more stressors and a lot of other things going on. So you just sort of get along and you do, and you can wake up one day and realize, I'm not really that happy or satisfied with what's going on,
Right.
So the realization is any human has to come to that, but really it's just like waking up and realizing I'm not in very good physical shape. And you say, I don't want to not be in good physical shape. Now you got to go and you got to work out. You got to do physical things to not be in bad physical shape. It's exactly the same on the mental and emotional side. You have to look at what's wrong, which
Mm-hmm.
isn't so pleasant often. And then you have to kind of make plans to, slowly work your way out of it, or work towards what does make you happy or what does make you, empowered, etc.
Mm-hmm. And so it sounds like, step one is the realization and having the awakening that, oh, I'm not
Always.
as happy or satisfied, which can be triggered by an illness diagnosis
Sure.
or a pandemic or
Yeah.
perhaps any other challenging external life situation that starts to get you thinking about things.
Yeah.
So step one, realizing that. Step two, taking inventory in your life and perhaps the
Mhm.
different areas on, and how do we do that? Maybe different areas of
Yeah,
life.
I think, yeah, because if you just have the realization part, that's great, but it's also like saying, I got to get in better shape and then not doing that. You know,
Right.
you actually, it, what I see for most people work well is sit with the realization and just say, "Well, okay, do I, is this a small, medium, or large problem for me? For a lot of people, it's not they're terribly unsatisfied with everything, but, you just sort of drift into patterns and habits that are easy and comfortable, but maybe aren't really leading you to a lot of fulfillment. So the first thing is just, is it a small, medium, or large problem? Because that'll kind of tell you how much work you're going to be doing. The
Right.
next thing though is literally just an inventory and saying, because almost nobody is unhappy with everything in their life. Like there's usually things that are great. You could say, gee, my relationship with my partner is pretty good. Like that's one of the great things. But maybe my relationship with, my friends has really slipped. I don't see them much anymore, and I whatever. Or, you know, my partner and I, it's great. Work really is not serving me. It's not making me happy. It's not, and then you can do a really broad survey of pluses and minuses, and then just look at the minuses. And first thing is there a theme? And a lot of times, and this is one of those hard truths. Um, a lot of times, the theme in our unhappiness is us. It's not that work really sucks that bad, or it's not that, if you got eight things that suck, you're the only thing in common with those eight things. So there's a piece of you within this, and that's like I say, these are hard things to look at. But the other side of it is sometimes they're fairly easy fixes. Um, for example, you might see a pattern that literally is just sort of a personality trait you have playing out in your life that you don't, that turns out you don't appreciate. An example would be, you're maybe a people pleaser and you tend to say yes too much. You say yes to too many things. And then the part you don't like is that now I'm overwhelmed and I'm, trying to do all these things and, I shouldn't have done this. And, so the real answer is, well, you're not going to find happiness in being overwhelmed. That's sort of the pattern you see. And the way to undo that is, take a step back and say, either I set up some parameters for what I can do and I can't do, or I find, I learned some new skills in communicating with people, realize it's okay to say no, or whatever. And it could be a lot of things like that, or physical things such as, I was talking to somebody and they didn't want to do it, but like they were one of these people that love the rush of always being just on time or a little late. And they would get up and not allow enough time to get all things taken care of before they got to work. And then at work they
I
were all
have this problem.
and and so their whole day was just like clawing, and so initially it's like this sort of, little bit of a adrenaline rush to do that, but every day if you're doing that it becomes sort of like, I wish I didn't feel like this all the time. They sort of work themselves into, either anxiety or some other thing. And so then it's, it's the same as someone who says yes too often. Then it's like, I can take care of myself a little better, and by doing that, that means I give myself more time and margin, and then I can do these things. So, and just like we see with patients, not being satisfied and not, being, fulfilled is going to be different for each person
Right.
because we're all different and, our constitutions are different in the way we play out our lives. And there's a lot about our constitution that makes us really strong and great and all that. And then there's these other things that are sort of the negative side that we have to clean up and say, that's not a good use of my, my superpowers aren't being used over there very well.
Right.
Um, but and honestly, that's where a lot of people kind of stop doing it. It's the same as, your first 2 days at the gym. The third day you wake up and you don't want to move, or something like that. It's that little initial bump that's the hardest really to get through, because A, you got to look at your pluses and minuses and be honest. B,
Yep.
you have to figure out why they're there, which that's especially if you've not thought about this and you realize, oh, gee, I'm doing that to myself.
I'm responsible. I'm at fault
I'm
for all
responsible.
of this.
Yeah.
So the bad news is we're at fault, but the good news is we're at fault, and that means we're in charge
We are
and
100% in
responsible,
charge.
and we can change it.
Yeah, we are 100% able to change it. Yeah.
So how do people keep the momentum going for a thing like this? We've done our
Yeah.
inventory, and now we need to make a plan to make some changes.
I think there's a couple of things in the one book I wrote that's kind of about this with cancer patients. I give a kind of a pathway for them to envision going through. But it really goes around, because this is very common when you get a cancer diagnosis, that you're part of what holds you back is you're grieving your healthy self, your person, the me without cancer. I'm grieving the fact I'm not that person anymore. And so you literally, the stumbling blocks become kind of like stages of grief, that most people know, that start with denial and bargaining, anger, all of those things that go on. So one of the ways that you can think about it is, again, it goes back to just taking time, which most of us modern folks don't like to do, and being still and quiet, because we have so many things that can be not quiet in our lives. But just taking a few minutes and saying, how am I doing? Am I, I've done the inventory and I've identified to do this. Am I doing anything about it? And kind of keeping yourself accountable, and then realizing, am I grieving this? Am I, like, even we can grieve the loss of bad habits, like things that we
Hmm.
shouldn't be doing. So, and then just be okay with that, because it's very human. And if you grieve it, then it can actually go away. The other thing, quite honestly, for most of us humans, I think, is actually working with somebody to kind of help coach you through this, because it's especially deeply seated habits and patterns we have that we do because they feel comfortable, but they don't lead us to happiness. Like, we all have those. A lot of times, an outside voice can be very helpful, because they can redirect you back to the path of undoing that, and maybe give you some tips for how. So it's not impossible to do it on your own, just doing a lot of journaling and tracking your process and realizing you're human. You're gonna not always make progress. Um, but I've found having an outside voice can be amazingly helpful, even just for accountability to the process or something. But sometimes just for some ideas, because we usually, these patterns are very deep rooted, and so we often don't see that they're as not appropriate or leading us, in the wrong direction. And an outside voice can really help kind of clarify that. So.
So a professional support, you mean, like a life coach or a health
Yeah,
coach or a healthcare
I've
practitioner, or?
I've seen healthcare practitioners do this. There's a lot in the cancer community. There are a lot of licensed mental health professionals, whether they're a psychiatrist, psychologist, social worker, but they just deal with people with cancer, and they they're very good at helping kind of shepherd people through that. So that's one way. If it
Hmm.
was something not as, as medically specific as the cancer part, I've seen people with their business coaches do this, or a life coach, or some other sort of accountability partner.
It might
Where
depend on
you,
the area of life
yeah,
that you're working on.
yeah, really,
Relationship coach or
yeah, what's appropriate, yeah, for
yeah.
that. Yeah, and if it's involving, like, a lot of other people, like your family or something, there might need to be a professional in that area
Right,
for you.
right.
But a lot of times, the general stuff, it's more they're gonna they're gonna work with you, and it's someone agreeing with you that we want to make this change, and I'm gonna help you, because you've lived X number of years and you haven't done it yourself so far. So I'm gonna be there to keep pushing you back, in the right direction, and that can be incredibly helpful.
Yeah. Are there any, so for anybody listening that maybe has a critical illness diagnosis or cancer or something like that, I mean, are there any top suggestions you'd have for them, that those people specifically, in terms of what they can do to start
Yeah.
this process?
I think specifically, like it, it's because we were sort of talking more globally about just life and all of that. But I think specifically when it comes to say something as overwhelming as cancer, when you get diagnosed with that, you can be the most centered, blissful person in the world, and that pretty much hits everybody pretty hard.
Yeah.
So I think specifically there. The process is similar. The first thing is coming to grips with the fact of what it means. And a lot of people, you get the diagnosis and you literally do go into denial first, and almost everyone does. And so your brain plays tricks on you. Oh, maybe it's a bad diagnosis, maybe I'm not that sick, maybe whatever. And so you have to, usually that's fairly short, but you have to get past that part. And then you have to sit down and kind of do a more micro version of what I was saying, with kind of making an inventory. But in that respect, then you have to step back and say, to the best of your knowledge anyway, as a patient, what does this mean to me? You have to list what your fears are, because if we don't identify our fears, they become our master. They literally will unconsciously drive behavior that probably isn't good for us. So if you're going through and you say, well, my fears are dying, my fear losing my family, my fear, my kids are young, my fear of whatever, financial problems, et cetera, you can get those out. And once you get them out, they're not secret anymore. They're part of something you can look at and work on. And then, after fears, you have to then look pretty rationally at, how is this going to really affect me physically and maybe mentally, emotionally, but physically to start out with? Will I have limitations, or is there going to be, like, one of the things we really frustrating for cancer patients is suddenly, they didn't have a lot of spare time to start with, and suddenly now there's a lot of extra treatment in their life and sucking up like every moment that they possibly have, and am I trying to work at the same time I'm doing all of this? So you have to kind of look at it and say, okay, if I'm diagnosed here and the best course of treatment means I need, you know, treatment X, Y, and Z, those take up this much time and space. You have to then look at it and say, that's part of my life now, and I need to find a way to make that, something that I expect. I don't, a lot of people have a lot of, they really like denigrate the experience because you don't want it. Who wants to go and get surgery or chemo or so? Nobody does. So then but if you, every day that you're going into those therapies, it's like, poor me, I hate this, this is a horrible therapy, I don't want to do it, which are all totally legit things to think.
Yeah.
You're never going to be happy at all.
Right.
If you keep doing that. In the beginning, it's great. Just let all that out. Everything sucks
It's
about
normal.
it.
Yeah.
That's totally normal.
Yeah.
But as you go through it, you know, if you don't find some way to come to a median with that, where, obviously this is no fun, but it's part of what I decided to do for my cancer, and it's going to be a part of my life, and I'm going to make it,
And I'm going to kick some butt.
as positive experience as I can. Those people actually do better. They're not any less affected by what's going on, but their quality of life and their ability to have, enjoyment with their family and friends and is still there. So I think those things, like the inventory, is a really tough thing to do, but very necessary. And sometimes you need help with that too, because we're so suppressed that we don't think about our
See
things
ourselves.
we don't want to look at, right?
Yeah.
And then looking at reality of, how do I fit in the book? I call it my new life, right? My new life with cancer. It's like, how do I fit that in, and how do we make that work? And because that then feeds back into your previous life of being a human. And let's say, if you're single and you got not a lot of people, in your world that, no one you live with and all this, you can kind of rearrange your life a little bit easier if you're in a family and maybe you're the primary, breadwinner, and there's some children or, other things. Like there might be a lot of communication with other people just to make this work out, so that you can do it. And those aren't always conversations we were ready to have with, our partner or family members or whatever. And that becomes a very big thing, and a single person has the opposite problem where they don't have anyone to, it's you and you and
Right,
you,
the support.
and
You need a
so
positive support
yeah,
network.
yeah, you really do, and you need everyone to come around you and say, yeah, we understand you're not going to be feeling good a certain amount of time. We know that you used to do all these things, and tell us what we can shift to other people.
Right.
That's a huge thing, because if you're trying to, like, John Wayne through it and go and, work as much and do every other thing that you used to do, especially with cancer therapy, you're not going to make it, trying to do all that. Not happily anyway.
Right. Yeah, some of it's just about getting realistic, I guess, and real
Yeah.
with your life. I don't know if you have any of these, but do you have any, favorite patient case stories or examples of someone, any favorite patients in the past that I know you teach and you've written books and podcasts, so maybe I know you can't talk about everyone, but maybe there's a patient that you've already shared their story or that you have permission to do so. Anyone that would be a good inspirational example for us today?
There's a number, thankfully, and honestly, the reason I wrote the book about this for cancer was I was mentoring some other doctors in treating cancer, and I realized that, like, and this is what we doctors do, we're very good at, like, the mechanical stuff, and do this treatment here and add this there, and all that, which is very necessary. But what I realized, that in the rush to do all of that, that we forget as doctors, is that this is also just a human being who's struggling with all of these, mental, emotional, and happiness and other things, and we that may not be our part of the job anyway, treating that, but we got to recognize that,
Yes.
and on the doctor side, you periodically have to step back and say, I just told you a lot of stuff. Is that too much? Like, does this sound like it's too much for you to do?
Right.
And if it is, that's fine. Let's find what you can do the next few weeks, and then let's not overwhelm you, because doctors, were very good at our plans, but a lot of times it might take the patient a couple of months to work into our plan, and we want it, today. So when I started thinking about, well, what's in common with people who just did better, like their quality of life was better and they seemed to live longer and all that stuff. And so I started thinking of patients, and it really was this: their diagnosis sucked just as bad as everybody else's diagnosis, but they found a way to live their life and evolve as a human towards, recognizing their negative stuff and stuff they didn't want to do anymore and all that, in spite of their cancer. So, like, they were some of the happiest patients we had. So there's a lot of those people. I think that the one that probably sticks out, I will use a pseudonym, because we wouldn't use anyone's real name, but we would call her Gia. Like, I call her Gia in the book too. I tell stories in the book about people. But in her case, she was a very, let's kind of describe her constitutionally. She started seeing me in her, let's say, later 50s, and she was, I think, either a high school or community college teacher. So she had been a teacher her whole life. Maybe she'd done both, and she was nearing retirement. She had started quite young, and she was nearing retirement. And she was really, like, she was an energetic, very kind of up, maybe not bubbly person, but a real, positive person to be around. And she had been not feeling well for about 6 months, just more and more fatigued and all of these things going on. And she came to me because we did people with chronic disease and, chronic fatigue and stuff. So she wanted me to work her up. Well, part of the workup for that is make sure there's no other diseases. So we do the workup, and unfortunately, all her tests come back, and I looked and I thought, oh no, that's why she's fatigued, because she had a type of a blood cancer. And so she came in and sat down and said, well, what'd you find? And I said, well, here's the thing. We found why you're fatigued, but it's not good news. I said, you have a type of, and I explained the cancer. And I said, on the scale of cancers, this is a very survivable one, very treatable, etc. But I said, it's still cancer. So, we have to connect you up with an oncologist and, get the ball rolling, figure out what you're going to do. Well, that was, the day you get a diagnosis, it doesn't matter how bubbly and happy you are, it hits you very hard. It's like getting hit by a truck. And she responded, I mean, of course, people are in quite a bit of disbelief when they hear that too. But we set up a time where her and her husband come back in 2 days later because we're trying to arrange the oncologist thing too. And they came back in, and she was sort of in the middle of kind of letting go of the disbelief, and then, sort of moving into just other ends of emotions. And her husband was a different place. Well, what I saw as time went on, because in her particular case, most cancer patients that we're working with from integrative oncology point of view, we see them a lot all through the different phases of their treatment. In her case, the oncologist told her, really, we should probably not aggressively treat this, but recheck you in 6 months and then 12 months and see if you're really progressing or if it's, level. So that meant we got to start to treat her right away using integrative things because she was really into that. So I saw her a lot. And basically, what she did, and her and her husband were super close. I had known them as patients for a while. They were very close, and they processed it together. But basically, there were a few weeks where they were pretty down, which is totally normal. And then they just decided, look, number one, it sounds like this is one of the good cancers, one of the ones maybe you can survive and all this. We have a good medical team. We've got a lot of support. The other thing, in their case, which is a very realistic thing in a U.S. medicine, they had good insurance, so they had less financial worries about a lot of stuff, which is that's a big thing. So they really inventoried, like, what are the downsides, that we're worried about, what are the upsides of what could possibly happen, and what do we need to change. So when they did that, and she had a counselor that she saw and kept doing, so she had outside help. But basically what they did is they said, well, okay, so what we're going to do is, you, meaning Gia, the wife, you could actually retire at the end of the next semester. And that would give you more time to work on your health and, de-stress and other things. So they worked on that. They worked on, like, her physical workload, and rearranging who did what and all of that. And they just worked through a lot of those things. And then she, over the months, following, let's just take the first year, she became like an encouragement to a lot of our other patients. Because they kind of, a lot of the cancer patients, especially if they get IVs, they're often together in a big room, and, we're not supposed to talk about what's wrong with them, but they always talk
They
amongst
do.
themselves,
Yeah.
and that's up to them, right? Well, pretty soon they all know each other's stories usually, and she was one of, we had a couple of people at that time where the room was just a lot lighter when they were there. Not like hilarious laughter, just they're, we would rather be playing tennis than getting an IV or doing whatever we're doing, but we can have a good time here, and we can realize this, we're working towards, a better life and all that. So she really, and I think because she took care of those things in the beginning, she became empowered, she became grounded and satisfied and all of that, and in spite of her diagnosis. And she, on one end of the spectrum, did have a very survivable cancer. And what's interesting is after the 6-month check, the oncologist said, keep doing what you're doing. Let's not institute anything crazy. At the 12-month check, he said, if you can keep it where it is, you may not need big chemo or any of that stuff, for years or ever. And so she continues to live on. But I've also had very similar patients who knew they were in their end of life. They had stage 4 advanced cancer, and they knew they were going to live some amount of time, but they didn't know how long. They'd outlived how long they were supposed to. And they became the same way, though, even facing, a sooner death, realistically. The death was just sort of an event in their life that was there somewhere. And they knew if they focused on that, it would rob all of the joy from their life in the meantime. And so different things to deal with, but it all goes back to the same thing, being very realistic, doing things to support yourself and everyone around you, and then finding ways every day to focus on what brings you joy.
Well, I hope that's been helpful for the audience listening in terms of things they can do to enhance their life satisfaction. Before we wrap, my final question would be, is there any question out of all the interviews and public speaking you've done, is there anything that you've never been asked before that you just wish, gosh darn it, someone would ask you this question? What do you want to share with people?
I'll tell you, so I've done a lot of interviews in my life, more in the last 2 years with COVID, but I will tell you, I was being interviewed. I will tell you one that I never thought I'd get asked, and I got asked on camera. I was being interviewed 3 or 4 weeks ago, and the interviewer said, okay, and it was a medically oriented interview, like it was about medical therapies and all this stuff. Right. At the end, the interviewer says, so I just have one more question. Are you beautiful? And they didn't tell us that question was coming. I was totally like, because my mind was over here and all these things they've been asking me about genetics and stuff like that. And I thought, well, that is an interesting, I bet they get some really interesting feedback on that when people answer it. So I'm glad you didn't do that one. So I have been asked if I'm beautiful. But honestly, not that I've been waiting for someone to ask me, but on topic here, honestly, no one's ever on a podcast or interview or anything asked me if I, are you satisfied? Are you happy? Those things.
Okay. Well, before we wrap, I do want to share with the audience your latest book, right?
Yes.
This book. And some of what you've shared today is in this book about how to go through a cancer diagnosis like that and the process and the journey of that. So it's called Cancer, The Journey from Diagnosis to Empowerment. And where can people get this book?
So if you like a non-traditional format like Audible or an audio book, it's on almost all the audio platforms, whatever your favorite one is. If you look up that title and my name, you'll find it. It's also on Kindle and most of the e-readers, the names of which I don't remember, but the other e-readers too. And if you want a signed hardback copy, they're on sale, cheaper than Amazon, and we'll put a link, I think, in your show notes for that.
Perfect. Wonderful. And if people want to connect with you further, do you have a website or anything that people can go to find out more about what you do?
We do. So the main website, which is a hub, and it's got links to all the other things I do, is just DRANOW. So dranow.com, DRANOW, and we'll put that in your link too.
Wonderful. Okay. Well, thank you so much, Paul.
Thanks.
Thanks for listening to the Are You Satisfied podcast. Links for any mentions from this episode are available in the show notes. If you'd like to connect with me, go to drsarahmurphy.com. That's drsarahmurphy.com. Also, don't forget to subscribe to this podcast. Definitely tell all your friends about it and leave a review. See you next week.